Good afternoon, everyone, and thank you so much for joining us today. I'm Mary O'Dowd, and I want to welcome you to our discussion titled Bold, Determined, Passionate, Women Leaders Transform Health. And I want to acknowledge that we are in the midst of Women's Health Week, which is recognized this year between May 8th and May 14th. And really, this is something sponsored by many organizations, including the federal government, as a time to encourage women and girls to prioritize their own health, both physical and mental. And this has never been more important. Given the last few years, many women have put off taking care of their own general health issues, as well as their general wellness needs. And in some cases, this has led to serious health problems for women. And so we want to take this moment to recognize that and encourage women and girls to reflect on their own individual needs and take steps to improve their overall health. It is also a great time for friends, family, and the greater community to take actions to support women to help them in achieving their best health possible. And this webinar is one of those actions that the Institute for Women's Leadership is taking. So I wanted to take a moment now and introduce our speakers today. As I mentioned, I'm Mary Marchetta O'Dowd. I'm the Executive Director of Health Systems and Population Health Integration for Rutgers Biomedical and Health Sciences. I formerly served as the Commissioner for the New Jersey State Department of Health. I'm a Douglas College alum, and I am the co-editor for the book Junctures in Women's Leadership, Healthcare, and Public Health. And I'm going to turn it over now to Dr. Denise Rogers so she can introduce herself.
Thanks, Mary. I'm Denise Rogers. I'm Vice Chancellor for Interprofessional Programs at RBHS. I'm also a family physician and have spent much of my career working with under-resourced and underserved patient populations.
And the other Mary Wachter.
Yes, hi. Thanks so much for the invitation to be here with everyone. My name is Mary Wachter, and I am work in government affairs in the biopharmaceutical space and have done that for about 15 years total. I am a registered nurse. I began my advocacy career for the New Jersey State Nurses Association, lobbying for nursing and patient healthcare issues in New Jersey. And I also spent some time as the Chief of Staff for the New Jersey Department of Health and as Chief Strategy Officer for the Central Jersey VNA, which is now the New Jersey VNA Health Group.
And I just want to take a moment to also mention that it is National Nurses Week. So Mary, thank you for all of your nursing leadership throughout your career. I'm now going to share my screen, and we're going to do a short presentation. And then we'll open the conversation for questions and answers. But if you are like me and have your questions as people are speaking, you should please feel free to use the Q&A feature and submit your questions as we go. And then we can keep track and try to ask those questions either in between or during the Q&A period near the end. So first, I want to just introduce the book that we're going to be talking about today. Both Mary and Denise are contributing authors for this work. It is sponsored by the Institute for Women's Leadership at Rutgers University. And the mission of the Institute is to advance women's leadership for a just world. And they do this through a variety of different strategies, including education, advocacy, and inspiration. And they sponsored a series of books focused on women leaders in a variety of different fields. This particular book is Women in Health. And the 12 individual women that we wrote case studies about are shown here. They cross very different backgrounds and experience and professional journeys, as well as personal journeys, and also a significant period of time. So some are in our history books and others are currently active working in their communities. And so this is the sort of bouquet of the women that we are presenting in the book, but today we're going to discuss 3 of them in depth. and 3 that specifically focused on the areas of women's health in their career. Virginia Apgar is a woman, physician, who was born in New Jersey, so a local, so to speak, for those of you who are from New Jersey. Her father was an influence in her life as an amateur inventor, and also the experience of her brothers. One died before the age of 5 from tuberculosis, and another suffered from chronic childhood illnesses. And this really inspired her interest in science and medicine. And she graduated at the age of 24 in 1933 as the 4th in her class from the College of Physicians and Surgeons at Columbia, and then decided to specialize in anesthesiology. This is actually a moment in time that people have talked about with some controversy as to whether or not she was appropriately mentored to go into anesthesiology, but it turns out it did serve her well. Some of her early accomplishments was that she was the first woman to head a specialty division at Columbia as the director of a new division on anesthesiology. We today see this as a prominent division of medicine, but at the time it was just very, very new. She is best known probably, I think, for the test that she developed, which is the Apgar score. And anyone born in the state of New Jersey and elsewhere is first given this test to see how they are doing from a health perspective as a newborn infant. And this at the time was a revolutionary new scoring system to do that evaluation and better understand how that infant was doing to intervene as necessary to improve the outcome and health of that new life. But then she also developed this system to encourage additional research and advocate for a real transformation in the area of obstetrics anesthesia, where she used the scoring technique as a way to measure the impact on infants relative to a variety of different things, but also including pain medication for the mother during childbirth. One of the things that she was quoted often saying is, "Do what is right and do it now." And she is quite a character, I have to say, in reading about her. She was always bringing emergency equipment around in her purse, regardless of where she was, because she would say things like, nobody is going to stop breathing on me. She wanted to be ready at a moment's notice to intervene. And I think it's important to note that at the time that she was advocating this as a teacher and physician, it was before many of the Good Samaritan laws that protect individual providers that intervene in an emergency from being liable of a bad outcome. And so she saw this as the right thing to do and advocated for intervention at that time, despite the potential personal liability that could have a negative consequence. She advocated for patient-centered, multidisciplinary clinical teamwork. This is something that many people are talking about now as being something new and revolutionary, but she was doing this back in 1955, and specifically in the space of improving care for women and newborns. She is described as honest, charismatic, and tireless, both as an educator and an advocate. And she was described as a leader who had the ability to get the best out of people without antagonizing them. Honestly, reading so much about her, I think it's her humor that humanized her so much in how she interacted both with patients and with the public as an advocate. And she was a lifelong learner. After achieving significant fame, frankly, in her field and in the area of medicine, for her Apgar score and the work around that, she decided to go back to school and get her master's in public health, because in her work, she had observed so many different birth defects. She really decided that this is something she wanted to learn more about. And in fact, this is a moment in time where she tells a story once that someone said up to her as she introduced herself as Virginia Apgar. They said, "Oh, I thought that was a thing, not a real person," because they had heard of the Apgar score, but not the person behind it. So at this point in her life, and this is the juncture in her leadership, she goes back to school. She has decided to further her education. And it's also a moment in time for the March of Dimes, which many people know today as an organization dedicated towards maternal and child health. But at the time, it had just achieved its goal of getting close to a cure for polio by advocating and supporting the development of the vaccine and then the implementation of the distribution of that vaccine around the country. And so it was trying to decide what to do with itself. And so they recruited Virginia Apgar to go and be a leader within their organization. And she really took that role on, leaving her academic medical career into a different world of advocacy around health and wellness, specifically around transforming the mission for the March of Dimes. She advocated for universal vaccination for rubella after an epidemic that caused many miscarriages, newborn deaths, and birth defects for children in our country. She co-authored a book, Is My Baby All Right?, which really went directly to individuals, patients, and families with children who were born with birth defects, both to prevent them as well as to learn how to manage through a family with someone in it that had a birth defect that needed a significant amount of help and support. And one of the things that she is also noted for in her leadership is from the March of Dimes, convening the first committee on perinatal health, which brought together national leaders that were very influential in developing a report and a blueprint for how the regionalization of perinatal healthcare should be created in our country. And this is something that has been credited as leading to the specialization and the ability to improve survival rates for those infants and mothers who have had difficulty at that time of birth in the course of time. And because of all of this work, not just her own individual research and the distribution of that, but also all of this work around advocacy, the Surgeon General was quoted as saying that Virginia Apgar has done more to improve the health of mothers, babies, and unborn infants than anyone else in the 20th century. And just to sort of highlight her enduring legacy that we may not all see is the work that she did advocating for the development of a data collection system around birth defects, which is now around our country. You can see New Jersey was one of the first to have included that in their public health work. This is still a tool that is used today. And most recently, it was a tool used to identify Zika cases or birth outcomes that were related to the Zika outbreaks that we experienced just a few years ago. And you can see in purple the March of Dimes and its enduring legacy in terms of its work around perinatal health, preventable preterm birth, and focusing on ending the equity gaps for all families. And so she continues to affect many of us in our lives today. And at this point, I'm going to turn the presentation over to Denise Rogers, who is going to talk about the woman that she wrote about.
Thanks again, Mary. So before I start more formal comments about Marilyn Gaston, I wanted to show this particular slide that really reflects the legacy of Marilyn's life that led her to do the work that she eventually has done. She says, we were poor, we were uninsured, she was not getting health care, and that's why she fainted. And from that point on, I knew that I wanted to do something to change that situation. And this is the story, essentially, of Dr. Gaston's mother fainting from severe vaginal bleeding that was eventually found to be cervical cancer and that eventually killed her. And clearly we know today that cervical cancer death should be completely preventable. Next slide, please. No, next slide? Yeah. Dr. Gaston was born in Cincinnati, Ohio. She grew up in the projects. When she was young, she describes telling people that she wanted to be a doctor and being told by any number of people that she was never going to be a doctor. largely because of both her race as well as her gender. However, she persevered, and in 1957, she graduated from Miami University in Oxford, Ohio, with a bachelor's degree in zoology as well. It was interesting that she and Virginia Apgar both did undergraduate majors in zoology. In 1964, she graduated from the University of Cincinnati College of Medicine. She was one of 6 women in her class, and not surprisingly for that time in our history, she was the only Black woman. And in 1968, she completed her pediatric residency and fellowship training at Cincinnati Children's Hospital. What's interesting in her history is that even before she completed her fellowship training in ambulatory pediatrics, she joined together with people in the community in Cincinnati to help found the Lincoln Heights Health Center, which was the first federally qualified health center in Ohio, and actually one of the very first in the country as a whole. In 1976, her husband got a job essentially in Washington, and so she and her children, along with him, moved to Washington, and she quickly was recognized for her talents and became the deputy director of the National Sickle Cell Disease Program. In 1986, she was the lead author on the NIH study that showed that prophylactic penicillin increased the life expectancy in children with sickle cell anemia. And this was a pivotal finding that completely changed how we think about and screen for sickle cell anemia, because after the publication of this study in the New England Journal of Medicine, universal screening for sickle cell anemia came into play because it was very clear that children who had sickle cell disease needed to begin penicillin prophylaxis by the age of 3 months. And so this was a monumental finding also in the sense that it increased life expectancy and quality of life for these children. Next slide, please. In 1989, she left her work in sickle cell anemia to become the head of the Division of Medicine in the Bureau of Health Professions. And the following year, she was tapped by Louis Sullivan to leave the Bureau of Health Professions and become head of the Bureau of Primary Health Care. She was the first African-American woman to head a public health service bureau in the United States. Next slide. One of the things that so impresses me with her is her philosophy of leadership. She says, quote, "We must be servant leaders. We must serve the people who utilize our services, and we must serve the people who do the work, those who work with us. As a leader, I believe it is important to recognize that I don't know everything, and I must be willing to learn from the people I work with." She goes on to say that I also believe that if you are faced with making a difficult decision and you consider the people that you are trying to serve, then make the decision that is in their best interest, and most of the time you will make the right decision. Unquote. Next slide. For her work in both sickle cell anemia as well as her work in the Bureau of Health Professions and the Bureau of Primary Health Care, she has been widely recognized nationally by a variety of organizations and institutions. And one of the joys of writing about someone who's still alive is it was very easy to find examples of this. And some of these examples are from the last year or two. Next slide, please. In the early 2000s, there was a change in the administration and the leadership of the Bureau of HRSA, actually, the Health Resources and Services Administration, of which the Bureau of Primary Care is a part. And Dr. Gaston sort of felt that there was a change in the commitment to excellence and the level of service that FQHCs had provided under her leadership. And so she came to a pivotal moment in her life of deciding whether she was going to stay in this role or move on. And she decided to retire from the federal government. She retired with a rank of being an admiral rather in the public health service, as well as an assistant surgeon general. And as she made this pivot in her career, it's almost like she went back to the legacy of her mother's life. And she and her co-author, Gail Porter, wrote a book, Prime Time, The African American Woman's Complete Guide to Midlife Health and Wellness. But of course, just writing a book was not sufficient for Drs. Gaston and Porter. And so one of the things they did is they created something called sister circles, where they brought midlife African American women together to support each other, to learn from each other, to really tackle the chronic diseases that many of them had. And furthermore, given her history as a physician scientist, they also got NIH funding to do this work and have done several NIH studies demonstrating the positive impact of these sister circles. Next slide, please. And of course, I have to end by remarking on this quote from her: "What you learn from a mentor is as important as what you learn in a classroom," because I am very blessed to be able to say that Dr. Gaston has been one of my mentors, which obviously has just been a wonderful thing for my life. And I will now turn it over to Mary Wachter.
Thanks so much, Dr. Rogers. Before I get started, I just wanted to thank my co-author, Erica Reed, who is a PhD candidate, and she may have actually completed that by now, a part-time lecturer at the Rutgers Department of Women's and Gender Studies, and a former program assistant at the Rutgers Institute for Women's Leadership. So thanks, Erica, for your partnership. Kathryn Dexter McCormick is a fascinating, not well known to many, women leader in the history of our suffrage movement and birth control movement. She was born in 1875 in Dexter, Michigan, into a really successful and influential family. And she was raised in Chicago for the early part of her life until her father's untimely death. And then she moved to Boston with her mother as an early teen. Her father was an attorney. She comes from a history of prominent attorneys. He led the relief effort in the Great Chicago Fire. Her dad supported women's rights before it was really welcomed, and he was an outspoken in his denunciation of slavery. In fact, her grandfather was, his home was said to be a stop on the Underground Railroad. And her great-grandfather was actually Secretary of War and then Secretary of Treasurer for the President John Adams administration. Her mother was active in charities for underserved women and advocated for what was known as prudent sex, a term that was used by suffrage supporters at the time to describe the use of contraception for deliberate birth limitations. She was drawn to the pursuit of an education in science and a desire to become a physician after her father died suddenly of a myocardial infarction in her presence when she was only 14 years old. And 4 years later, she lost her beloved brother to meningitis. So upon moving to Boston and really focusing on her education, she enrolled not after jumping through lots of extra hoops as a woman, into MIT, and was the second woman to graduate from MIT in its history and was the first to receive a science degree. Unfortunately, she did not continue to pursue her medical school because just after she graduated, she married a man named Stanley McCormick, who was from an extremely wealthy family. 2 years into her marriage to Stanley, he became debilitated by severe schizophrenia, which afflicted him for the next 41 years until he died at age 73. And through all those years, Kathryn remained a very loyal wife to Stanley and was very active in his treatment plan and advocated for advances in treatment and research of mental health, including endocrinology, which was thought at the time to be a cause of schizophrenia, and other therapeutic areas. She was a founding funder of the Neuroendocrine Research Foundation at Harvard back in 1927. She became engaged in the suffrage movement while Stanley was ill, and her engagement actually began before she met him at MIT, where she was the first representative of what was called the College Equal Suffrage League at MIT, even though the institution refused her request to hold organized meetings on campus. She got involved and held leadership positions in organizations such as the American Women's Suffrage Association and the International Women's Suffrage Alliance. She funded almost virtually on her own the publication Women's Journal, and she made speeches, all across the country that made it very clear her position that the right to vote was important, not just for the empowerment of women, but also for gender justice and equality and equity. Her advocacy, as well as many other leaders, ultimately resulted in the historic passage of the 19th Amendment to the United States Constitution in 1920. If you get the next slide, please. Around this time, it was in 1917, Kathryn first met Margaret Sanger, and they both quickly recognized their shared compatibility that centered on women's rights and freedom of choice. Kathryn became a delegate to the 5th Annual International Birth Control Conference in London in 1922. And while she was there, this is one of the things that she was most known for, notable sort of in her advocacy efforts. She smuggled in over 1,000 diaphragms, which were illegal in Europe, into the United States, where they were illegal. And she had sewn them into the linings of high fashion women's apparel, dresses and such, stuffed into trunks, and distributed them throughout New York City. And so, as I said, it was illegal at the time, and this was pretty, radical but important steps that she made in her efforts to allow and provide contraception to women. She did step back for many years, actually, in her advocacy for the birth control movement to focus fully on Stanley's care until after he died in 1947. And at that time, she began her reinvestment in the birth control movement and joined forces with Dr. Gregory Goodwin Pincus through Margaret Sanger's introduction and re-engagement with her. She became the primary and untraditional donor, investing more than $2 million, which today is about $18 million. I say untraditional donor because she was deeply involved in every detail of the scientific discovery process of Dr. Pinkin. It's important to acknowledge that his work and their work on all of this drug development for an oral contraception, that there was a lot of social and scientific bias that led to unethical protocols of clinical trials, their clinical trials. There was enrollment of psychiatric patients and underserved minority women to the trials that occurred at a time before there were major and really important reforms to scientific research. Kathryn was what is now known as an angel investor. She was motivated not by financial rewards, but by the impact on reproductive rights and her deep understanding of scientific and not just her understanding, but her pursuit of scientific innovation. Next slide. Her legacy, it was in June 10th, 1957, that the first oral contraception, which was known as Envoid, was approved by the Food and Drug Administration. It was such a significant contribution that the CDC recognizes as one of the top 10 health achievements of the 20th century, family planning and contraceptive services, because of its influence in altering the social and economic roles of women. Still, as you can see, and this data is just a bit old, but approximately 61 million women of reproductive age, and about 70% of them being considered at risk for unintended pregnancies. And between 2015 and 2017, 65% of these women were using a contraceptive source, and the pill is the most popular among them, with 25% of these women using this choice of contraception. And again, the pill is 99% effective when taken as directed. Lastly, certainly not one of her major contributions, but certainly one that I think is notable, is that she funded the first women's dorm at MIT in 1959, when she learned that MIT was unable to admit more women because of their so-called lack of housing. And she did dedicate that dorm, and it's still named after Stanley, her husband. She also agreed to fund the first, a month before her death in 1967, she did attend the dedication of the second wing on this dorm. So at this time, I'm going to turn it back over to Mary.
All right, I figured out how to unmute myself. I just wanted to share this QR code for the book if you haven't had an opportunity to read it and would like to, based on this presentation. You can actually use the discount code there, and the proceeds for book sales will go to support the Institute for Women's Leadership. And so I wanted to give everyone an opportunity to just have that. And then I'm going to stop sharing my screen, and the speakers will take Q&A. I do have a few questions that I'm going to ask, and but please feel free. Again, the Q&A feature is at the bottom of your screen, and you should feel free to put any questions that you have for us, and we'll be happy to discuss them. But I'll start with one question that both Mary and Denise, you can answer. That one of the takeaways that we have learned through this book, but also just as a society in the course of the last 2 years, is how quickly scientific advancements and change can occur. And through your own professional experience, as well as having reflected on some of that through the work of this book, what would you see as the best way for individuals to stay on top of that for their own health or for the health of their communities?
Well, certainly as a family physician, I will plug a website called familydoctor.org, which is just loaded with very high quality patient information. What I fundamentally believe, again, as a family doctor, though, is if you have questions that are specific to you, that really pertain to issues that you have concerns about, you should speak to your own healthcare provider. It's important to sort of bring these concerns to your family physician, nurse practitioner, PA, so that they can appropriately address them in the context of your own issues. I'm also a big fan of sort of the disease-specific websites, so the American Cancer Society, the American Diabetes Association, the American Heart Association. They generally have very accurate, up-to-date information. As does actually Kaiser Permanente. And I think I've put a lot of these links in to make them available to people who are attending this, so that they can have access to some of these resources.
Excellent. Mary, do you have anything to add to that?
Yeah, I would absolutely, echo Dr. Rogers' statement about the patient groups. They are a wealth of information for patients that may be suffering, or family members who are suffering from various conditions or new diagnoses. And so, they have access to cutting edge research and treatments, and can help people access clinical trials. Some of the more traditional places like the NIH has, lots of really amazing information about new and cutting edge research, as well as the Biotechnology Innovation Organization. It is also the traders organization representing biopharma industry, but has lots of information there that's accessible to the public that can help give them, connections and to what's happening in that sphere.
I think, Mary, the one last thing that I do want to just say out loud is that one of the things that COVID has proven to us is how quickly misinformation can spread. And so I very much urge people look at websites that are .gov, that are .edu, that are in some instances .org. Stay away from a lot of the .com. And if something doesn't sound right, check more than one site to see if the information is accurate, because we paid a huge price in this country for an enormous amount of misinformation that is available on the internet.
Very, very good point. And I will just echo that and share that, there are a few websites that I go to for the up-to-date COVID information, but the CDC is one of my go-to for almost everything. And I really do, value their input, as well as, they can give you access to information for those who are not the science-oriented community, as well as those who want to go read the publications that led to those documentation. So it's a helpful resource for a whole host and range of potential readers. We do have a question about the discount code. It's been answered in the chat, but just to remind people that discount code only works if you're purchasing through the Rutgers University Press website. If you're going through Amazon or one of those other online purchasing organizations, you can't use it there. So just wanted to mention that. Back to the content, though, there was a question about were there case studies or women that we wanted to highlight in the book that didn't make the cut, and if yes, can I share? So the two women on the screen would have been women that we would have included in the book, but one of the things that we were striving to do was to provide a geographic diversity. And if I included every woman that I worked with and admired in the state of New Jersey, it would have been a New Jersey centric book. And I think that maybe could be the sequel. But there were so many women. And just another backdrop to this is one thing that was a little bit different about how we approached this particular volume from some of the others is that Ruth Charbonneau, my co-editor, and I really tried to find contributing authors that had lived or practiced in the same space as the subject matter. And then sometimes we identified an author, and Denise is one of those, where she said, I like the person that you've identified, but I have someone better, and that's Marilyn Gaston. And I'm so glad that she did that, because I really, I was just floored with Marilyn as I got to know her as just an incredibly stunning person inside and out. So we were so lucky to have relationships with some of these women who volunteered and participated in this work. And then others where we identified a woman, and Katsy Cook is a good example of this, who is a midwife in the Mohawk Nation. And Ruth and I felt very focused on the fact that we needed someone who really understood that culture to represent that case study, and neither of us felt that we could do that. So we actually did research to find a researcher who was involved in that community, and Elizabeth Hoover is someone we did not know but found through our work to be that author. And we think that that helped enrich some of the content of the book itself, because for example, Mary Wachter is in the space of biopharmaceuticals and could understand that journey of the development of a new drug in a different way than myself or Ruth could, who have not been in that space. And the next question I actually have, Mary, is for you. And this is a question about how common is it in today's day and age or in history for a person to invest in drug development the way that Kathryn did? Because, many of us are not in that world and don't understand the influence that an individual could have as she did.
She was absolutely a trailblazer in that work. It's much more common now to have individuals funding some of this early research, and the path for a product to make its way to patients is very perilous, and it's fraught with a lot of risk. It requires a lot of investment, especially early on. And with only a tiny fraction of new compounds ever making it to the FDA for review or ultimately approval. So, early drug development, as I said, is extremely risky and is definitely the most fragile part of the process. And it can take years and cost billions of dollars to successfully develop a successful product. Large biopharma companies these days are investing less in the early part of the development, and where they used to invest a lot in this sort of more dynamic, riskier phase. But more and more bigger companies are stepping back from that, and they are looking more to pick up the products that are further along in their development and are in a safer place in terms of investment. But that means that private investors, such as these angel investors, and like Kathryn was, are now playing a more important role, providing that early investment and shaping this sort of, critical decisions about the advancement of future treatments and health technologies. And, a major driver for an angel investor nowadays is the, return of investment. It's the financial reward. And Kathryn was not motivated by that. As I said, she was motivated by, the importance and human right for women to have access to a really effective, easy to take oral contraception. So,
Denise, the next question I have for you, you mentioned that Marilyn Gaston was a mentor of yours. And so how was it for you to interview her and write about her in this way?
It was wonderful. I mean, first of all, it gave me an excuse to spend a fair amount of time with her, mostly over the phone, because we were in the midst of COVID. And she's 83 now. And so there wasn't going to be a lot of me trying to be there in person. But, I have known her since 1989 and kind of knew parts of the story, but not all of it. And it just made me admire her even more and love her even more. So it was terrific.
Mary, this question is for you, Mary Wachter. One of the themes of these case studies in particular with Kathryn is the advocacy. Her role in an advocacy in a number of different campaigns, for her husband, as a spouse and care provider, for voting rights for women, and then in the advancement of oral contraception. And you've also had a role in advocacy yourself in your various professional journey. So what is your take relative to the importance of advocacy in health and advocacy in particular in women's health?
Well, I don't think I need to mention the obvious, that it could just be weeks or even days that women's healthcare delivery in the United States could shift in monumental proportions. And so I'd say that there's never been a point in my lifetime that advocacy for women's health has ever been more pressing. So I think that all of us who've got these skills and built these capabilities and leveraging all of our resources and tools in the advocacy space is going to be more important than ever. So, and the way we go about doing that, and the variety of tactics, and there's just a plethora of them, will all need to be probably harnessed very soon.
Denise, you have been an advocate, and you've also written about Marilyn and her role as an advocate in government as well as outside of it. So do you have anything to add to that?
Well, I think one of the lessons actually from the book and reading the various chapters of the book is the need for us to maintain a clear-eyed view on women's advocacy, looking at issues related to intersectionality. Because our history is complicated. So on the one hand, Margaret Sanger did wonderful things. On the other hand, Margaret Sanger believed in eugenics and was very anti some things that were not in the best interest of African American women. And so as we look at what may change in this country coming up relatively soon, it is important for us to say out loud that these changes will disproportionately impact women of color as well as poor women of all races and ethnicities. And so our advocacy must be with that lens. So as we talk about, doing things to ensure that women have appropriate access to reproductive health, we need to also, though, recognize that women need to have access to basic things like adequate housing and food and sort of the basics, because when we become too narrowly focused on these issues, we don't take into consideration the variety of adverse realities in many, many women's lives in this country that lead them to have poor outcomes. And that's one of the most important things that Marilyn Gaston really did teach me. I mean, I will say out loud that in addition to working in community clinics for most of my career, I've also held fairly rigorous administrative roles. I was actually the last president of UMD&J, and I always carried with me her reminder that when you're faced with hard decisions, look at what's in the best interest of the people that you're trying to serve and make the decision that is in their best interest. And I think all of us need to do that as we move forward in advocating for a variety of women's rights in this country.
Very, very eloquently said. I want to take a moment and just pause and mention what the Institute for Women's Leadership, the statement they have related to the current situation on women's reproductive rights is that, they say that we stand in solidarity and support for reproductive justice in the United States. And so I think we will all be watching carefully over the next few weeks to see how things develop in our country. And both of you have made important statements about how to consider those changes. I also want to reflect, Denise, on something you said about the broader health impact. And sometimes either if it's in the area of maternal child health or reproductive health, sometimes women's health gets narrowed into a very specific area. And I just wanted to reflect that that was one of the other goals of our book. The three women that we highlighted were very focused on sort of this space in some ways, but not all. Marilyn Gaston was much broader. And I think that if you look at the other compilation of women that we've identified, we've looked at women who focused on environmental health, women who focused on food safety, global distribution of equitable distribution of drugs and medicines in a global format. So many, many areas of health that are women's health issues. And I think the other mention that you talked about is this broader sort of social determinants of health and looking at the whole person. And one of the things, and this is where we met, was in a federally qualified health center once upon a time, Eric B. Chandler on George Street, for those of you who are Rutgers alum. And I just, wanted to ask you, for those who are less familiar with the federally qualified health system, centers across the country, could you share a little bit about what they are, how they came to be, and how they work on these issues of health equity?
So I'm going to try to be very fast in my answer, but I have to give a shout out to another woman in the book, Risa Levizo-More, who, when she was president of the Robert Wood Johnson Foundation, really brought to the forefront these conversations about social determinants of health and moved us away from this notion that the way you improve health is just by what happens when you go to the doctor's office. It was a very bold and brave move on her part because it also led us down the road of talking about racism and discrimination and its impact on health and health outcomes. And so I can't answer your question without doing that shout out first. And then, of course, what I'll say is, again, having spent much of my career, over 40 years, working in community clinics, including the Eric B. Chandler Health Center, One of the most important things that Marilyn Gaston did was she partnered with Don Berwick from the Institute for Healthcare Improvement to make sure that there was high quality healthcare provided in FQHC. So people often think that, oh, these are places that, the poor go and the care is probably not as good. Under her leadership, it was documented that the care provided at FQHCs was often of a higher quality than was being provided in the private communities. And so we need to sort of hang on to that, and we need to, in whatever ways we can, advocate for continued support of federally qualified health centers and recognize the important role they play in making a difference in the lives of people who are underserved.
So I'll just second that by saying, one of the things that I think is so helpful as a model in terms of how federally qualified health centers deliver care is that they bring everything into the building together in one shot. So if you need lab work, you walk across the hall. You don't have to make a separate appointment and go to a separate thing. And as a busy woman with 3 young boys, that is an obstacle. And I have a lot of access to healthcare and insurance. And so I think that it's really important to see that as a real true model of how to deliver services in a comprehensive way in the delivery system. So I've always seen them as a very high quality model. One of the other questions that I have is, what is something that you learned in this work that was a surprise or changed the way that you think about health or leadership? And Mary, I'll ask you to answer that one first.
Yeah, I'd say it's probably more an observation versus a surprise, but to see some of the, real examples of how much a need sort of the, scientific research and, the ethics around, the clinical trial development, et cetera, was just, staggering at the time. There was just really, we've come leaps and bounds forward in that regard. And so it's prompted me to be more curious about, some of the women leaders who were probably, part of the movement to, reform that scientific innovative process and create more ethical guidelines and standards for the research that takes place in nowadays. So that was certainly something that I found enlightening and interesting for certain.
Denise, do you have something?
Yeah, I think reading the book reminded me once again that Maya Angelou is right, that courage is probably the most important virtue because without it, one cannot practice any other virtue with consistency. And I think the thing I'm struck by is the enormous courage, obviously, that many of the women sort of from historical periods had to display to get where they are, McCormick, Apgar, but the continued need for courage. I am struck by how much has been done and yet how much remains to be done.
Maybe a little more personal. One of the things that surprised me is how much I didn't know. Learning about these women, even the ones that I knew about, I learned so much, and so many of them I didn't know about. And yet the connection I felt to them because of the impact that they've had on my life personally and my health, when I recognized and saw what they had done, as well as professionally. When I worked at the health department, the food safety program was there. And so understanding that this woman who had been working over 100 years ago had started some of that, and it affected my work today. And the work that Virginia Apgar did in setting up, things that were under the certificate of need process or this data collection system for newborn health. It was shocking to me how much I didn't know. And, I'm sure my dad would like to hear that because I've been telling him all I know for a very long time. So, it's one of those journeys where, you continue to learn. One of the things that another question that we got was around the themes of the book. A few of them are around mentorship and teaching. And how have you experienced that in your career journey? And I'll just share that both of you have been mentors and supporters of me in my career journey. I know I wouldn't have gotten certain jobs without your endorsement. So thank you for that. And I think For me, many of the women that were contributing authors of this book were those people that I had worked with and for throughout the course of my life, and it was wonderful to work with them in this way and learn with them about other women that had done similar things. And Denise, you had a really good slide about how important mentorship is. For me, I feel like that is such an important part of our obligation as women leaders who have been able to make strides forward, to reach back and help and support other women on their journeys. And I will note that there's a question in the post about how to get and to support the Institute for Women's Leadership. And so we'll put the website in the chat, but there are many opportunities, both financial support as well as getting involved and supporting and mentoring other women. So I'll just turn it over to you now, Mary, and then Denise to talk about your experiences of mentoring and teaching.
Yeah, I had, was blessed with amazing mentors. In Rutgers, I went to my first internship at the Center for American Women in Politics conference in San Diego, and got it, delighted with that work. And the dean of the College of Nursing at the time was Dorothy DeMayo. One of my longtime professor mentors is Dr. Susan Reinhardt, who was also faculty at Rutgers. I had an amazing experience there, and carried that forward with my mentorship by Andrea Augenbach, the New Jersey State Nurses Association, and Barbara Wright, who was an assemblywoman nurse in New Jersey for many years. So I've been really blessed with some amazing women leaders in New Jersey that, helped me create a path. And I try now to give back as well, engaging with some mentor programs at my place of employment and some other women who I have been able to stay close to and guide along the way. So I really feel it's important to, give back. As I'm continued to be mentored, I'm also trying to continue to mentor others. So really great opportunity, and thrilled to be an alumni of Rutgers and have been able to take advantage of all that they've offered me in my career. Denise?
Yeah, I think the only thing that I would add is obviously Marilyn Gaston was a wonderful mentor for me, probably the most important in some ways in my life. But I've also had a number of important white male mentors. And they've been incredibly important to me, actually, because they helped me understand how a lot of white men think. And in my life, there's not a natural way for me to know that. And it has helped me to understand how to navigate some of these large institutions. And so the other thing I would urge us as women, and certainly I mentor a number of women, from students to residents to faculty to department chairs, but we also need to mentor men, because we can influence how they think about some of these issues as well. So that would be my last 2 cents.
Well, on that note, I will just mention that I am the mother of 3 young boys who are, I think, clearly feminist, as sometimes they criticize me in my old ways of thinking. So I think we're moving forward, but we have come to time. So I want to thank you both so much, Mary and Denise, for joining me today on this journey of the book and then on today's conversation. And I just want to close with a quote from one of our other case subjects, Swery Moon, who has been very involved in the international conversation about the equitable distribution of medicines and drugs around the world, in particular for some time, but in particular with HIV/AIDS, as well as most recently with COVID. And her comment and her quote is, "The power to change the world can often occur when groups of interested players come together around powerful ideas to unite in a common voice for a greater good." And I think that's something that we can all think about as we move forward in our various paths and intersections. So thank you very much for joining us today, and I hope you enjoyed our conversation.